Well, I became a doctor maybe because it was a family disease. My grandfather was a doctor, my great-grandfather was a doctor, my father was a doctor, and my mother was a pediatrician. And I was interested in treating people. I was interested in people's health. And then I had the luck of having a father who was a very bright person, who was not only a doctor but also a first-class biologist. He was heading a laboratory where he let me work when I was a student. It was a laboratory on enzymes. And at that time, enzymes were not that well known, and it was great to work on things which were that innovative. I did my medical studies, and at the same time as I was good at music, I did a lot of music. I was playing the piano, I was an orchestra conductor. I created the University Orchestra of Paris. And at some point I had to choose between becoming a conductor or a doctor. And I finally chose to be a doctor. Maybe I made the wrong choice, but I have not regretted my work in medicine and in going towards people. And it's true that very early I was oriented towards taking care of people who were particularly poor or who had very difficult living conditions, especially people living in developing countries. So I specialized in infectious diseases, in tropical diseases. I worked in Africa, I worked in Asia, I worked in international organizations, and I have been very happy to be able to be of service. And in particular, I've worked on the issues of access to medicines, of finding the right medicines, the cheap medicines, the medicines that were able to take care of illnesses of people who didn't have enough money to buy expensive ones or to be supported by a very developed health system. This has been one of my main concerns, and I was lucky to be able to do that with some success. I was in charge of the pharmaceutical sector in the World Bank long ago. That means helping countries with their pharmaceutical policies, with access to medicines, with access to quality of medicines. This has been something I've been very proud of contributing to.